So maternal mortality in Haiti is really high. I mean, it's on par with, sub-Saharan African countries that are in a really bad state. It's really very, very bad. And there are a lot of reasons why that's so. One is just the general level of poor healthcare, like lack of health infrastructure. So there are no places for women to actually go to get healthcare. A second issue is having to pay for healthcare. So user fees are a major obstacle for most women to actually come to the health centre and get seen. Transportation is really difficult. It's mostly on donkeys or barefoot over mountainous areas. And women, it's really difficult, especially when you're pregnant and probably anemic, to try to walk in and out of the clinic to be seen for your antenatal care. Then when you're actually in labour, that's the last time you want to get on a horse and come down to the clinic, especially in the rainy season. In the rainy season it's muddy and it's really difficult to do it.
This is Fall Fair, which in French translation means the deep hell. It's really strange to see it now. It's just like a tiny little creek, but it really is a major impact on not just, health, but also on all the economics on the other side of the river, because what happens in the rainy season is every afternoon around 3 or 4 o'clock it rains, and I think in part because of the erosion and the lack of good soil up in the mountains, the water rises really rapidly. So you can be standing here and it'll start to rain, and within 20 or 30 minutes there's a flash flood and the water rises up really high. I've personally seen 2 women who died because we weren't able to get them across the river in time to have cesarean sections. And we have a lot of community will, people will carry the women across, but at a certain point it's just too dangerous for anyone to cross, so we can't do it.
Conj is a referral centre for all of our other sites. So in Bucancre, if we need a C-section, we send them here. So she knew she was going to have twins. They had told her. This makes 6. She's now got six children. She's 28. I think the average birth rate is about 4 or 5. And the issues are really complicated because women don't necessarily always have real control socially over their fertility. They're really highly dependent on men for their economic standing. And in unions between men and women, it's pretty much expected from the man that there will be a child, that the woman will have a child for him. So I've had women who have had 10 children already who come, and when I counsel them about family planning, they say, well, I don't really want to do it yet. And when I delve a bit deeper, it's because maybe their previous partner died or their previous partner left them and they're with a new partner, and that new partner really wants to have a child with them. And so their option is to either not do that and risk him leaving, or do that, have a child with him and then have 11 children, but at least she hopes that he will help to support those 11 children. So it's really quite complicated. I think those are kind of the list of reasons of why it's so hard for women. One of the ways that we've addressed it is obviously by having no user fees for pregnant women. So pregnant women in Zambia Santé don't even pay the 60-cent requirement that some people pay. So they're excluded from any fees whatsoever.
Okay.